If you're turning 65 and still working, you may be wondering how Medicare interacts with your employer-sponsored health insurance. Do you need to enroll in Medicare? Can you keep your employer plan? What happens if you delay enrollment? Well, understanding how Medicare coordinates with employer coverage is essential to making the best financial and healthcare decisions. So in this video, I'll break it all down so you can move forward with confidence. So let's dive in. My name is Kevin Lee, and this is the Golden Canopy Health Management channel, where we are dedicated to ensuring health, enriching life, and embracing retirement. So when you become eligible for Medicare at age 65, but still have employer-sponsored health insurance, the way your coverage works depends on the size of your employer. Now, if your employer has 20 or more employees, your employee's health plan is considered primary and Medicare is secondary. This means your employer insurance will pay first and Medicare will cover some of the remaining costs. If your employer, on the other hand, has fewer than 20 employees, Medicare becomes primary, meaning it pays first, and your employer coverage is secondary, meaning it pays whatever is remaining. In this case, if you are working at a place with fewer than 20 employees, you typically need to enroll in Part B to avoid any gaps in coverage. Okay? Now, because of this distinction, it's important to consider benefits carefully. If Medicare is expected to be your primary care, but you don't enroll, you could face significant out-of-pocket expenses. Okay? So one of the most important considerations is credible coverage. Now, credible coverage is a very important term, which means that your employer insurance meets or exceeds Medicare's standard, particularly for prescription drug benefits under Part D. Now, if your employer coverage is credible, you may choose to delay Part B and Part D without facing any late enrollments. However, if it is not credible, you should enroll in Medicare as soon as you become eligible to avoid penalties and gaps, okay? Now, to determine if your employer-sponsored plan is credible, you should request written confirmation from your HR department. This is especially important for Part D prescription drug coverage, as failing to enroll in a timely manner could result in lifelong penalties, okay? Remember, any late fees you require, you accrue. It's not a one-time payment. You pay it for the remainder of your life that you're on Medicare, okay? Now, whether you should keep your employer plan, transition to full Medicare, or combine both depends on several factors. Cost is one of them. Comparing premiums, deductibles, and out-of-pocket expenses between Medicare and your employer plan. Typically, your employer plan takes, $120 to $170 each paycheck, whereas your Medicare Advantage plan is a once a month for 2025 is $185. So do keep that in mind. Of course, coverage is another thing to consider. Access, whether your employee plan provides better benefits than Medicare alone. Family consideration is also something to keep in mind. If your spouse or your dependents are covered under your employer plan, switching to Medicare could impact their coverage. Many individuals find that Medicare provides more affordable and comprehensive coverage, particularly if their employer plan has high premiums or deductibles. However, for those with strong employee benefits, delaying Medicare enrollment may make sense. Of course, you won't know that. I won't know that until I'm able to sit down with you and take a look at that stuff with you. Making the right decision about Medicare and employee coverage is critical to ensuring you have the best healthcare plan at the most affordable cost. If you're unsure about your options, I can help you navigate the process. At Golden Canopy Health Management, we specialize in Medicare education and enrollment, helping you determine the best course of action based on your unique situation. You can call us, you can email us, you can visit our website, and you can also click to get your complimentary 2025 Medicare guide to help you make sense of this crazy, wacky world of Medicare. Don't forget, your health is very important, and your peace of mind is also very important. With over 3,000 plans, there's no need for you to try to navigate all the options yourself. Please reach out to Golden Canopy Health Management. Thanks so much for watching. We'll see you next time. Thanks.